Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. We are from Group 5 are going to present about the sexual transmitted disease in oral cavity. There are 6 members in our group, which are Muhammad AZIQ bin Muhammad AZMAN, Ahmad ABID ARFAN bin Ahmad RAFIZAN, NURUL AINA BALQIS BINTI ISMAIL, NOREEN DARWISYAH binti Cik Muhammad ZUKRI, FARAH AIDA binti Muhammad FAISAL, and AHMAD FAYYADH bin Muhammad AFENDI. The table of contents include: first, introduction; second, risk factors; third, clinical manifestations and managements; fourth, preventions; and fifth, case study. We start with introduction. What is actually sexual transmitted disease? Sexual transmitted disease, or known as STDs, and also known as sexual transmitted infections (STIs), refers to a variety of clinical syndromes and infections caused by the pathogens that can be acquired and transmitted through sexual activity. According to the Centers for Disease Control and Prevention (CDC), sexual transmitted infections (STIs) are a group of contagious disease most commonly transmitted from person to person by close or intimate contact. There are more than 30 different bacteria, viruses, and parasites are known to be transmitted through sexual contact. These include: for bacteria STDs are syphilis, gonorrhea, chancroid, lymphogranuloma venereum, granuloma inguinal, chlamydial mycoplasmal, and uroplasmal infections. For viral, human papillomavirus HPV infection, HIV infections, acute viral hepatitis, genital herpes, molluscum contagiosum. And last but not least is for parasitic. These includes trichomoniasis, scabies, pediculosis pubis. There are many other infections are not considered primarily to be STDs, including salmonellosis, shigellosis, campylobacteriosis, amoebiasis, giardiasis, hepatitis A, B, and C, Zika virus infection, and cytomegalovirus (CMV) infection. However, this can be transmitted through sexual activity. All these infections can also be non-sexually, such as from mother to infant during pregnancy or childbirth, known as vertical transmission, or through blood transfusion and shared needles. The World Health Organization (WHO) stated that more than 1 million STIs are acquired every day worldwide. A person can have an STI without having obvious symptoms of disease. Common symptoms of STIs include vaginal discharge, urethral discharge or burning in men, genital ulcers, and abdominal pain. STIs can have serious reproductive health consequences, in some cases beyond the immediate impact of the infection itself, such as infertility or mother-to-child transmission. I guess that's all from introduction. Next, we proceed to the risk factor.
Next, I'm going to present the risk factor of sexually transmitted disease in the oral cavity. Firstly, unprotected sexual activity. Based on study by Center of Disease Control and Prevention, there is a high chance to get some STD in the mouth or throat from oral sexual activity to a partner with an infected genital, either to vagina, penis, or anus. This condition can be worsened when those individuals with infected mouth or throat giving oral sex because there is a high chance to get certain STD on their partner. At the same time, improper or inconsistent use of condom can also lead to increase in the risk of getting oral STD. Unprotected sexual activity make up the highest percentage of an individual getting STD in the oral cavity. Next, having multiple sexual contact with multiple partners. When certain individuals having sexual activity involving oral with multiple partners, the higher the percentage of getting STD in the oral cavity. Lastly, vertical transmission from mother to infant. This risk factor is lowest in percentage compared to the first two factors, but still can lead to oral STD. Certain STDs such as gonorrhea, HPV, HIV, and syphilis can be passed from an infected mother to her child during pregnancy or delivery. STD in infant can cause serious problems or even death in some cases. Thus, all pregnant women should be screened and treated if found positive.
So now let's look at clinical manifestations of oral STDs. Okay, so first, for hepatitis, the clinical manifestations include flu-like symptoms, fever, diarrhea, jaundice, dark urine, pale feces, and also abdominal pain. For gonorrhea, the clinical manifestations includes pain during maturation. Male usually shows inflamed testicles, pus discharge from genitals both in male and female, and also patients tend to have frequent maturation, burning sensation during maturation also, and for women they may have heavier periods. For HIV, patient will tend to have fever, fatigue, palpable lymph node, weight loss, and also has secondary oral yeast infection, shingles, pneumonia, and also diarrhea. For clinical manifestations of syphilis, the patient will have a rash marked by red all over their body, fever, enlarged lymph node, soreness and aching. They will also complain of patchy hair loss, myalgia, fatigue, and sore throat. Patients with human papillomavirus infections usually come with small flesh-colored or gray swellings around their genitals. They may also represent in the form of warts on a cauliflower shape with itchiness and discomfort in their genitals. Lastly, for herpes, the clinical manifestations includes patient comes with headache, fever, pain or itching around the genitals, and they might also complain that they have blisters around their face and may also with discharge with itchiness at the blisters.
Treatment and prevention of oral STD. The treatment of oral herpes are: the first one is choline salicylate gel. It is used for pain control of cold sores. Number 2, topical and oral antiviral agents such as acyclovir. Next, laser therapy. It is used to decrease pain and reduce the number of recurrences. And lastly, chlorhexidine and benzidamine mouthwash. They are used to treat gingivostomatitis. The treatment and prevention of HPV. The first one is by surgical removal. It is important to remove HPV growth. Next, cryotherapy. It is used to remove damaged or diseased tissue. And lastly, for prevention, is by vaccination. The treatments of HIV are antiretroviral drug, ART, preferred initial therapy, and also chemoprophylaxis. The treatment of syphilis is by giving antibiotic injections such as benzathine penicillin and also azithromycin. The treatments of hepatitis is by prescribing antiviral drugs such as pegylated interferon, lamivudine, and adifovir, while for the prevention is by giving vaccination such as Angerix B, Shinvax, and Genevax. The treatment of gonorrhea is by prescribing antibiotic such as ceftriaxone intramuscularly and azithromycin orally. These are the prevention of oral STD in general. Firstly, it is important to practice safe sex, including safe oral sex. Maintain a high standard of oral hygiene, which can reduce the risk for developing any type of sore or infection in the mouth. Having vaccinations to protect against some infections. Get better access for young people to sexual health services, which can deliver advice, screening, and treatment of STIs. In need of interventions to promote sexual health, which are proven the effectiveness. Last but not least, health education has a role to provide information and skills in the area of relationships and sexual health.
Last but not least is case study. Here is the summary on case study of symptomatic primary hepatic gingival stomatitis by Mervyn Turton. The patient is basically a 9-year-old female, presented with main complaint of difficulty in eating because of pain associated with multiple shallow oval ulcers. She experienced constant pain in the entire mouth without burning sensation, and the pain increased when she was eating and difficulty in swallowing. She also appeared weak and dehydrated, present with fever. Her speech was slurred, and the medical history shows that she does not have allergies and tested with HIV negative. Upon extraoral examination, the patient shows enlarged submandibular lymph nodes that were palpable on both left and right side, which were mobile, tender and soft in consistency. For intraoral examination, the patient shows upper labial mucosa that's surrounded by erythematous area, inflammation of marginal and attached gingiva, ulcers on the buccal mucosa and lateral border of the tongue, and multiple ulcers on the lower gingival mucosa and floor of the mouth. The patient also shows a severe halitosis, high salivary flow rate, and severe plaque and calculus build-up that deposits on her teeth.
After the clinical examination, the patient is diagnosed with primary hepatic gingivostomatitis. Primary hepatic gingivostomatitis is the most common viral infection of the mouth. For the treatment of the patient is asked to rinse with anti-inflammatory and analgesic oral rinse containing benzamine chloride to ease the topical oral pain. The patient was also given paracetamol and metronidazole suspension because it is hard for the patient to swallow pills. The mother was advised to give her soft diets, copious liquid intake, and adequate rest. On presentation for her recall appointment 1 week later, she had regained her health, the ulcer had healed without scarring, and the gingiva was less inflamed. Her pain and fever had subsided, and she was eating and communicating well. So that is all from our group. Thank you.